Welcome to Houston, We Have a Doctor, the podcast that takes you behind the scenes with the physicians, surgeons, and healthcare leaders shaping our city. I'm your host, Dr. Sterling Carter, physical therapist, Army veteran, and the founder of the award-winning Sterling Physical Therapy and Wellness. Each week, we'll sit down with Houston's top docs to hear their stories behind the scrubs, how they're changing lives, innovating care, and keeping Houston strong. Let's get started. Hey, Dr. Adams, how are you today?
Good morning. I'm wonderful. I hope you are.
I am doing great. And thank you for joining us on our podcast, Houston, We Have a Doctor. For all of our listeners out there, this is an opportunity for us to share and get to know the best doctors in the greater Houston area. And it is my pleasure to introduce you all to Dr. Amy Adams, a good friend of mine. We are super excited about the partnership that we have. And Dr. Adams is with LifeStem, and I don't want to take away any of the thunder, so I'm going to allow her to share a little bit about her journey and her background. So let's start with my first question for you, Dr. Adams. Just tell me about how did you end up in medicine? How did you go from wanting to go and get into med school, going into med school, to where you are today?
It was a long process, I have to tell you. I kind of always wanted to get into medicine. I wasn't sure whether I wanted to do research or clinical or both. And ended up going to graduate school in pharmacology after my bachelor's degree. And then from there realized it really was a clinical thing that I was interested in. So went to medical school after that and did my residency in anesthesiology and then subspecialized in interventional pain. And I've been doing that for 20 plus years. And then along the road started realizing that this new thing where you use your body's natural ability to heal itself works incredibly well, far superior to just steroids alone, and doesn't have the downsides. So a few years ago, I completely morphed into a orthobiologics or regenerative medicine practice exclusively. So now instead of doing steroid injections and all the typical interventional pain things, it is all regenerative medicine.
That is so amazing. And there's so much research out right now that just talks about the benefits of stem cell and regenerative medicine. And it's just amazing that how far we've come in regards to medicine and just the gains and the research and all of the great things that we're seeing today. So that's really exciting. So tell us about med school. Where did you go for medical school?
I was at the University of South Carolina in Columbia. I actually lived in Charleston before I went to medical school. I had a choice to go several places, Charleston included, but decided to go to Columbia to be closer to my in-laws. And it was turned out to be a really good move because I moved to Columbia about a week before Hurricane Hugo hit Charleston.
Oh,
So I didn't have to deal with that.
that was a
It
perfect time to
definitely
move.
hit Columbia too, but not nearly as bad.
That's great. That's great. And so I guess you have to tell me from Charleston to Columbia, and how did you end up here in Houston?
I from Columbia ended up in Savannah, Georgia, and spent 20 plus years there. And then I was recruited to come to Houston to be medical director for a large national franchise of regenerative medicine clinics. I was the medical director in Houston and Dallas for 9 clinics. And then at some point just decided that I could do it better on my own. It could be more personal, smaller, more hands-on, high-touch experience for my patients. And so LifeStem came into existence, and we are exclusively in Houston now.
Excellent. So, I want to learn a little bit more about LifeStem. It's just so exciting what you guys are doing. So, Dr. Adams, as far as like the ideal type of patient that you would see for your stem cell and regenerative medicine procedures, who's that ideal candidate?
We have all ages, but I would say the most common type patient that we see is someone who used to be very active and now maybe they can't be as active as they want to anymore. Maybe they can't get down on the floor with their grandkids, or their golf game is really suffering and they miss it for whatever reason, whether it be a bad knee that needs to be replaced, but maybe you just don't want to do that awful surgery, or a bad back, for example. We all know that back pain is its own special form of torture.
So true.
So, so we see all kinds of patients, but I would say our most common is someone probably in their 50s to 80s who just wants to get a little pep back in their step.
Yes. So that's so amazing because Dr. Adams, you and I, with Sterling Physical Therapy, we see almost the identical patient population, and we have the same type of wanting to do more of a conservative treatment approach versus invasive, steroid injections, surgeries. If we can prevent those things, it's always great.
Absolutely.
So I love that. So the same type of patients that we're looking for in physical therapy are those that are just not getting around as much anymore, and maybe starting to walk with a walker or a cane because of the pain. And so on our side, we're working on the strengthening and conditioning functional training, but the pain sometimes keeps our patients away from being able to really progress. So I love having something like LifeStem and what you're doing to kind of help build that bridge and allow them to have the reduced pain so they can build their muscles back up and improve their function. So very, very
Absolutely. It takes a village, right?
yes.
It's almost never a thing where we just inject someone and send them on their way. They've got to get the rehab to maximize their function, and then they can go and be themselves again.
That's right. I agree 100%. So let's talk about your industry, your field of medicine, and what changes you've seen, in regenerative medicine over the last few years. Has there been any kind of, recent updates, or tell us all about it?
Oh, there's updates literally every day. When I first got into regenerative medicine, it was still kind of hocus pocus a little bit. Nobody really understood how this platelet rich plasma thing really worked. They
Uh-huh.
just knew that it did. And it fixed things that were never fixed before, like tendonitis.
Yes.
And so we've learned a lot more about how the body works to heal itself. And that's really all we're doing is we're harnessing that body's own ability to do what it should be doing. And we're concentrating it and we're putting it very precisely under image guidance where it needs to go in order to basically turn back the clock and make you heal like you're a child again. And so we've learned over the years now that, for example, dose matters. Everyone knows if you take a tenth of an ibuprofen, it's not going to work as well as if you take two.
True.
So it's the same is true with regenerative medicine. And unfortunately, there's a lot of people out there not adhering to that and not giving the proper dose. But we're very research oriented here. We track all of our outcomes and we know that dose does matter, and it matters to do a very precise injection. So that's kind of where we are now. And then the new up and coming thing is cultured stem cells in this country.
Okay.
I think everyone's heard of the athletes traveling overseas to get their stem cell injections.
Yes.
And that was because the cultured stem cells until very recently weren't available in this country. We have now partnered at LifeStem with a company in San Diego called Personalized Stem Cells. And we are in the midst of phase 2, finished phase 2A, starting phase 2B, FDA approved clinical trials for cultured stem cells. And now, under the federal right to try laws and compassionate use laws in this country, we can offer it to very many people and not have them need to travel overseas to get their treatments.
I love it. I love it. So now we have somewhere to go to get cultured stem cell treatments that typically everyone is flying, you're absolutely right, all over the country, or all over the world, I guess, to get those procedures. But no, you no longer have to do that, Houston, because we have Dr. Adams here with LifeStem. So that's so amazing. I love it. I love it. So a couple of things just to learn from you in regards to stories. Like, I don't know, share a story with us about a patient that you've treated in the past and the outcomes that you've had with your procedure.
Oh, wow. So there's quite a few, obviously, but for an example, we have a gentleman in his 50s who his back was killing him. He was not able to be active anymore, seriously considering going on disability. And with one treatment in his back, he's back out doing his deep sea fishing, pounding through the waves, no pain at all. When we followed up with him, he was literally crying. He was so happy. We have another patient in who's a grandmother and couldn't get down on the floor with her grandkids anymore. When she flew from Houston to California to see the grandkids, she could barely get out of her airplane seat. Now she's walking through airports pain-free. She's playing with her grandkids on the floor. She's doing all the things she wanted to be able to do as a grandmother and virtually pain-free. So that's the type of people that we just love working with, the ones that want to get back to their lives.
Right. I love it. That's such a great, and I know, Dr. Adams, because you've been involved in pain for an extended period of time, but for a lot of the lay, kind of the common people out there, they don't really understand how debilitating pain can be, and how by reducing pain it can completely change our lives. Our blood pressure, it actually goes up when we have pain. Our mood changes, and of course our function changes. So when we remove pain from someone's life, everything gets better. And so it's just an amazing experience. So thank you for sharing
It really
those
is.
stories. I love it. So before we wrap up, I always like to ask about Houston and the community, and just tell me a little bit about what you love about the Houston community, and why it's important for you to serve the community at large.
I absolutely love Houston. It is, I've lived in the South my whole life. I am very used to, grew up with Southern hospitality,
Yeah.
and I value it. Houston is the epitome of Southern hospitality. Everyone is nice here. Well, I mean, obviously not everyone, but the vast majority of interactions I've had here are over the top nice, even beyond Savannah or Columbia or anywhere else I've been. Just fantastic. And the diversity is so much fun. I love meeting people who are not really just like me.
Right.
So that's a lot of fun.
Excellent, excellent. So, Dr. Adams, we talked a couple of days ago. Cannot wait to come and get my treatment to my left shoulder. So we all have
Yeah, we
pain
can't wait to
issues.
get a hold of you.
So I'm going to see you in January. But for all of our other patients, past patients, and just the general community, if we want to get in contact with you and want to set up an appointment with you, what's the best way to go about doing that?
I think the easiest thing to do would be to call us. Our number is 346-588-7836. And our website, if you want more information, is regenerative medicines with a plural S on the end, .net, regenerativemedicines.net.
Excellent. Thank you so much, Dr. Adams, for your time. I know you're so busy, and I just appreciate you taking a moment out just to spend it with us. And just for all of our listeners out there, if you like the podcast, please like, share the podcast with others, and just pass out the good word, and come back and see us again for our next podcast that will be coming up soon. So thank you so much, Dr. Adams, and you take care, okay?
Thank you, Dr. Carter.
You're welcome.